What are the biggest headaches around guided surgery? Well, there's a two-part answer to that. Part one is the doctor's side and part two is the lab side. On the doctor's side, there's usually a few things, and one of them is, of course, the records, right? Because it's not freehand. You don't go right to surgery. You have to gather records, upload them to your laboratory, and do all the things that we do. And often the records are not right. So that's a headache. It's a headache for you, your patient, your staff. It's a little bit of a headache for us. So how do you overcome that? That is through education, through checklists, through process, through double checking your work before it's uploaded. Don't dismiss your patient until the records are verified, even by us. So we have a live verification process. A patient sits in the lobby, uploads your records, we check them, and if they're perfect, dismiss the patient. If not, they're right there. Take some new records. That's the biggest headache. But there's also other things. In surgery, takes a little bit longer than freehand, right? You have to work the instruments to make sure you're going in straight. Sometimes you have to set fixation. Often you have to make sure the right tools, the right process. You have to follow a drill sequence that might be a little bit more cumbersome than a freehand case. But ultimately, our argument is that once you dial all that in, guided is really the way to go for a number of reasons. I won't get into all the reasons. We want to get into the headaches. On the laboratory side, again, usually the headaches are records, but we just talked about that. So overcome the records and then the headache is gone, for the laboratory. But the other part for the laboratory is that there's a lot of responsibility, right? Now we're taking on the guidance of the implant and designing of the case. So there's that part of it. But then there's also all the other things that come with a surgical guide, right? We have to design it, we have to make it, we have to QC it. In order to QC it, we have to have all the keys and tools here at the laboratory. We have cabinets full of drills and keys and spoons and sleeve and all these things to make sure that the guide is made right. In the software, you have to understand so many things. The software itself, placing implants, planning implants, putting prosthetic components on, prolongation. You have to determine if it's going to be sleeve or sleeveless, what tools you're going to have to use to get the case ready. And then, of course, just designing the guide in the software. Like all those things are headaches for labs. And you hope that a laboratory took baby steps before they take on big cases. But there are a lot. So you always want to work with an experienced guided surgery lab. Not necessarily an experienced implant lab, but you want to work with an experienced guided surgery lab for all those things. It's very important to you and to the lab, to the patient, to everybody, that you have a lot of experience with it. Those are the headaches.